All right, here we go. Hello, everyone, and thank you for watching this video on fee schedules, discounts, and prepay plans. My name is Dr. Marty Kotler. Let me tell you a little bit about myself before we get going. I'm the president of Target Coding, and I'm a chiropractor. I practiced for 16 years prior to starting my company, Target Coding. I'm also a certified professional compliance officer and certified billing and coding specialist. And my area of expertise is in compliance as it relates to billing, coding, documentation, risk management, record keeping, Medicare, and HIPAA. Okay, let's get going. So, common question we get is how much should you charge for the services you render? What resources should you use? You can go with your gut instinct, or you could use some of these resources. You could take a look at the personal injury fees that are provided in your state and the workers' comp fees to compare them to your fees. You could take a look at the Medicare fee schedule, which is probably going to be lower than what you would like to get paid for your services. You could take a look at the fees paid by United Healthcare, Blue Cross Blue Shield, Aetna, Cigna. You can base your fees on your experience. Many of you have taken numerous postgraduate courses. You may be certified in many different specialties. You should probably charge more than others. You can compare your fees to other chiropractors and medical doctors that do similar services in your town. You could also purchase CPT code books and take the real scientific approach. And there are certain standard factors that determine fees. For example, your overhead and administrative costs. How much does it cost for you to pay your staff to work on billing and coding and submitting claims? Your malpractice expense. Affluent regions will typically support charging higher fees. Lower socioeconomic regions, you probably have to have lower fees. Think about this. Chiropractors that practice on Madison Avenue in New York City are probably going to have higher fees, higher rent, and higher malpractice costs than chiropractors in Omaha, Nebraska. Yeah, I have a question for you. Is one fee really possible? We get this question from a lot of students that work with us when they first graduate chiropractic school. They may say, "Hey, Dr. Kotler, I want to charge $75 for every man, woman, and child that comes into my office." Is that possible? Is it probable? It's probably not possible. Let me give you a few reasons why. So let's say you want to do that. You want to say, well, my standard fee, my regular fee, $75. Okay, great. Now you may go in network with a plan like Aetna or Cigna or United Healthcare. Well, they might say, well, we don't pay $75 for a treatment. We pay 60. And then you may become enrolled in Medicare. Medicare is a federal government program where there's mandated fees. That might be 45. Well, I want 75. Well, sorry, with an adjustment in Medicare, it might only be 45. Workers' comp fees and personal injury fees may be more than 75. And then your cash fees, you want it to be 75. That's nice. So now, just a comment here, being part of all or some of the above does not mean you have a dual fee schedule. You may have heard of that term, dual fee schedule. So you want to avoid dual fee schedules, but what is a dual fee schedule? So a dual fee schedule will occur when you charge different fees for the same service, depending upon the insurance company and the patient without a compliant rationale. If your standard fees are rarely or never collected, that's a problem. So it becomes a compliance concern when you bill insurance companies higher fees while regularly accepting much less from cash patients for the same services. So let's go through a few of the options patients have, financial options. So let's focus on cash fees. There are four choices. You have a cash fee, that's nice. So some patients may want to pay as they go, one visit at a time, which is not the most convenient, but that's what some patients may want to do. Many of you rather have the patients pay for multiple visits in advance with a discount and a prepay program. And some patients are going through a financial hardship, so you may need to significantly discount your fees. So those are the four options for cash. And then most of you have mixed practices. Most of you do not have all cash practices. So you may be out of network and accept assignment. You may have a few patients where you're in network, and there in those programs you must accept assignment. Most of the doctors we work with do accept Medicare, personal injury. Some of you may want to become part of a discount medical plan organization like Cairo Health USA, which is one of the best ways to prevent dual fee schedules and charge whatever you want for your cash patients. Some patients like to use their health savings accounts, and some states allow membership programs, concierge care, and direct primary care. Now, offering patients 12 visit, 24 visit, and 36 visit packages is something that we encourage. We recommend it. We're fans of it. Now, there are pros and cons to this. The pros are patient pays for multiple visits in advance. What does that do? Less administrative work, less congestion at the front desk. And these patients very rarely miss their appointments. Patients that prepay for their visits, they use them, and they're great cheerleaders of chiropractic. Now, some of the negatives to care plans is if you offer this to in-network patients, it may be violating your contract. I don't recommend collecting deductibles and copays in advance before the services are rendered. And if you are taking care plans, finances in advance, you may need to put that money in an escrow separate account and withdraw the money as the services are being rendered. Now, what allows you to have a discount? Discounts are okay. It's okay to have a normal fee of, let's say, $100, and here comes Mrs. Smith, and you could say, well, instead of our normal fee, which includes insurance billing and collections, we see that, Mrs. Smith, you're going to be a cash patient and you will not be using insurance. Well, we can give you a little bit of a discount. Why is that? Here are the reasons. No insurance billing. Therefore, no fees required to pay staff or a billing company. There's no need to obtain insurance information or verify coverage. There's no need to complete insurance pre-authorization forms. No need to track or post payments from insurance companies. No need to wait weeks or sometimes months to receive reimbursement. You're getting paid right at the time of service or in advance. Now, the amount that you offer, the discounted amount, should bear a reasonable relationship to the amount of avoiding billing and collection costs. In my opinion, the range is about 10 to 25 to 30%, again, depending upon what your typical costs are. Now, some offices will say, well, we offer senior discounts, military discounts, student discounts. And my question is, why so many? Have the same discount across the board for all categories. Some offices will say, well, we offer family discounts. So the first parent, we give a 10% discount. The second parent, 20%. The first child, 30%. The fourth child, 40%. And all the other kids are free. I don't know if that's the best way to do it. What is your discount based on? Your discount shouldn't be based on if they're a senior, a military person, or they have 5 children. And it should not be automatic. Keep your fees simple. We're working with 3 doctors right now that have had board complaints from patients directly related to fees. Let me show you what I would consider a non-compliant 24 visit fee schedule. You say, Mr. Taylor, we're going to be doing an exam, x-rays, 24 visits at $60 each, 24 tractions, 2 re-exams. That totals $2,585. So what we're going to do is we're going to give you a 60% discount. So that totals $1,034, and you can make 2 monthly payments of $517. I don't consider this appropriate. So this is confusing. It's complicated. So that's why we've put together a fee schedule analysis service. What we can do is review your most commonly billed CPT codes. We'll give you the going rate for those codes for your zip code. We'll personalize a range for what we think would be the most appropriate for your zip code. We'll do a care plan customization for your 12 visit, 24 visit, 36 visit packages. And we'll also give you target codings fee schedules. So if you're interested in having this program, let us know. Contact us. Here's my contact information. Email is info@targetcoding.com. Website targetcoding.com. There's my phone number. You could scan that QR code to schedule a free consultation, or you can give us a call or send us an email. By the way, we also offer many other products and services. We have memberships. Level 1 membership is only $99 a month, and it includes attendance to all of our webinars. And we do 4 to 6 webinars a month, including CA boot camps, unlimited question and support, and you get monthly videos and newsletters. That's $99 a month, and you pay as you go. Another service we provide is Medicare credentialing. Do you need a PTAN number? Do you need to go through recredentialing? Are you hiring an associate chiropractor and need to get the reassignment of benefits to your practice? Do you have to make simple changes to your profile in PICOS? We could help you with that. Doctors, be careful if you are having in your profile, let's say your staff member is named Emily, and she's the recorded person in your profile, and Emily leaves the practice. Now you could have problems if you have to make changes because your billing manager is not there anymore. So what makes us different, we log in with you and we show you where to make the changes so you could do them on your own after we're done with you. So we'll help you fill out all the forms. Let us know if you're interested. We also offer many webinars, 25 different topics, from soap notes, treatment plans, modifiers, managed care, neuropathy, personal injury, HIPAA, how to scrub EOBs, and DCPT integration. We also write billing and coding compliance manuals. Best way to prevent whistleblower action is to have policies and procedures where all staff members are on board. Staff want good organization in a practice. They want streamlined operations. So we'll put together one for your practice. It doesn't take that long to put together. You get a nice 3-ring binder with all your policies. If you don't want the hard copy, if you don't want to use the hard copy, your manual is sent to you digitally. You get both. We also write HIPAA compliance manuals. If you see Medicare patients, you are required to have a HIPAA compliance program in place. I have a book that I wrote on the best codes to improve reimbursement. So we have options to fit every practice: cash practice, in-network, out-of-network, personal injury, Medicare. Again, here's my contact information, email, phone number. Feel free to set up a consult. Thank you for listening. I hope you learned a lot. Take care, everyone. Bye-bye.